I'm Carrie Weaver, and today we're going to be discussing congestive heart failure. So as new graduate nurses, I would hope that at the end of this module that you'll be able to understand and discuss the causes of congestive heart failure, list the signs and symptoms, and then discuss appropriate nursing interventions. So some facts about heart failure. About 5.7 million people in the United States are diagnosed with heart failure. That's 1 in 9 deaths in 2009 listed CHF as a contributing cause. About half of the people who are diagnosed with heart failure die within 5 years of diagnosis. That's a very high comorbidity rate. And then one alarming fact, that is heart disease kills more people than stroke, HIV, and cancer. So heart failure is a disorder in which the heart can't pump enough blood effectively, so it's either not filling enough, or it's not pumping enough, or it could be both. As you can see in this diagram here, in diastolic heart failure, the heart isn't filling enough. So the chambers here become stiff and thick, and it's unable to contract. And in the systolic, the heart can't pump enough. So the chamber is overstretching, the blood is pooling, and it's backing up and not being able to be pumped effectively. This is just another picture of a healthy heart and a heart with failure in it, and you can see the difference in the chambers here. This is overstretching where the blood is pooling, and this is not here. So some risk factors for heart failure. If you have coronary heart disease, so if you have this, your arteries become narrow, and the heart will have a harder time pumping blood effectively to the rest of the body. High blood pressure puts additional stress on the heart, puts more pressure on the arteries, it can't pump effectively. Your diabetes and obesity kind of go hand in hand. If you're overweight, you're going to have more risk for coronary heart disease and high blood pressure, which can lead to heart failure. The race, it is definitely higher in African Americans. Then you have your heart conditions. So if you have pre-existing heart conditions such as arrhythmias, cardiomyopathy, your heart valve defects, previous heart attack. And then if you have other factors, HIV, AIDS, smoking, illegal drug use, alcohol use, those put you at risk, as well as age. If you're 65 and older, everything, if you think of it as you age, the muscles weaken, and you are at more risk for having these other disorders that can lead to heart failure. There are different types of heart failure. There's right-sided and left-sided. In the right, it's the inability of the heart to pump blood effectively into the pulmonary circulation, so you're going to have that back up into the lungs. In the left-sided, it's the inability of the heart to pump into the systemic circulation, and that's where you're going to have the back up into the whole circulation. Systolic is the inability of the heart to contract, while the diastolic is the inability of the heart to relax. Signs and symptoms. The 3 most common signs and symptoms of heart failure are shortness of breath, dyspnea, orthopnea, which is your inability to lay flat. Your fatigue is your second one, and that's just where the patient's overly tired. This may be a chronic finding that over time they're just saying, I'm so tired, and it could be that they're having some heart failure. And swelling, especially in the extremities, your ankles, your legs, your arms, jugular vein distension, which is your JVD, maybe some ascites, which is swelling in the abdomen. A chronic finding that some patients complain of is chronic cough or wheezing, nausea or lack of appetite. Confusion or impaired thinking is kind of a late sign. So if the patient is having these symptoms, there is lack of blood to the brain. And then the high heart rate that can relate to your arrhythmias, or just the fact that the heart is trying to pump more quickly to get the blood to the rest of the body. So how do we diagnose heart failure? There are a couple different ways. A family history, so if your patient has a high family history of heart failure, they're at more risk. Your physical assessment we're going to talk about on the next slide in a little more detail. Your lab tests, so a very quick venous blood draw, you can do a BNP, which is a B-type natriuretic peptide, and this is a hormone produced by the heart. It's released in response to the heart failing, so it's going to go up. And as you get the heart and the heart failure more stabilized, it's going to lower back down. So that's a good test. Your EKG can show any heart arrhythmias. It can show if they're having a heart attack. Your echocardiogram, that can take a detailed look by almost ultrasounding the heart and seeing what the structures look like. Is the heart enlarged? Are the valves damaged? And your chest x-ray, that's going to show your cardiomegaly, which is your high or your enlarged heart as well. Physical assessment, this is similar to the signs and symptoms, but what is your patient going to look like? So when these patients are coming in a heart failure exacerbation, they're going to have the increased work of breathing. They're really going to be working. You might see that they're, when you take a listen with your stethoscope, you might hear abnormal breath sounds, wheezing, rales, rhonchi. They might have a blue discoloration to their lips or nail beds, which is your cyanosis. Abnormal heartbeats when you're listening, or you might see them on the monitor. High blood pressure, because that is a risk factor. Pitting edema, that's when you're going to look at the extremities. So there's trace, mild, moderate, severe, different levels of edema that you can just press into the skin. Your anxiety, so the patient's going to feel very anxious. They're going to feel like they can't breathe. And then you may see the ascites, where you're going to see the swelling in the abdomen. In addition to the increased work of breathing, you're going to also look at their pulse ox. So the pulse oximetry may be less than 95%, and they're going to have a high respiratory rate, greater than 20. Treatment is aimed at treating the underlying cause of the heart failure. So you're going to want to find out what is causing it. Can we treat that? So the high blood pressure, the diabetes, making sure we're managing that. Reducing the symptoms, so if they're having shortness of breath, ordering breathing treatments or other treatments we're going to talk about later. Stopping it from getting worse, so we don't want the patient to get to the point where they need to be intubated because of their work of breathing. And then increasing their lifespan. You know, a 5-year lifespan is, you know, from diagnosis to death, that's a big thing. It's pretty substantial. I am going to hand out a handout to all of you. This just kind of talks about the guidelines by the American Heart Association, so I'll pass this out to you. It talks about the different heart failure patient education, so it goes over all the treatment goals and everything like that that we can discuss with the patients. So I'll let you guys read those. All right, so next about treatment, a couple of these we'll touch on. Heart healthy lifestyle changes. So that is your making sure the patient is monitoring their weight, making sure they're exercising, staying active, trying to lower their weight, stopping smoking. The ongoing care, that's going to look more at long-term, working with the healthcare team, making sure they're going to their follow-up appointments and their checkups regularly, so that everybody's part of the team, so that we can prevent. Prevention is the big thing. We don't want them to get readmitted to the hospital. And we're going to talk about the medical and surgical procedures. So surgery, this would be a last resort. We're going to start with medications and see if we can help the patient that way. Surgery, pacemaker, that's going to help both sides of the heart contract at the same time. Your implanted defibrillator if the heart goes into abnormal rhythm. Mechanical heart pumps and valves, so we can fix the valves so that we can treat the heart failure that way. And a heart transplant would be the last option. I do want you to remember this mnemonic. It's your LMNOP. Lasix, that is going to help output the urine, so it's going to absorb the sodium and chloride and water, and essentially you're going to pee it out. So your Lasix. Your morphine is going to help decrease anxiety, and it's also going to help open up the airways and help with the oxygen flow. Your nitrates, those are a vasodilator, so that's going to help the bronchioles dilate and let more oxygen and blood in. Oxygen, more oxygen will help the patient's work of breathing. And then your positive pressure ventilation, so this is your BiPAP, and this is going to force air into the airways to help the patient breathe. Positioning, you want to sit them upright with their legs over the side of the bed, and then pee as in urinate. So that's what the mnemonic stands for. So in conclusion, I know that was a lot, and there are plenty of more medications I want you to know as well. You're going to look at your blood pressure medicines and things like that. But those are the main ones. But I want you to really remember that prevention is the key to managing this disease. So getting all of the healthcare team on board, working together so that we don't have these patients being admitted to the hospital over and over again. And then your manifestations, so your top 3 are your fatigue, your shortness of breath, your edema, and your making sure that once we are diagnosing that we're treating promptly so that these patients are not having their symptoms worsen and thus their heart failure worsen. Do I have any questions from anyone? All right, so I have a couple questions for you guys. I would like to see if anybody, I want to make sure that you guys can teach back what we kind of went over here. So can anyone name the 3 most common risk factors or causes of heart failure? Yes.
Hypertension, coronary artery disease, and diabetes.
Perfect. And then can anyone list the signs and symptoms? So what do these patients look like when they're coming in with an exacerbation?
Edema, shortness of breath, fatigue, JVD, anxiety.
Very good, very good. And then can anyone state the most common medical intervention? So what is that mnemonic that we're going to do for the patient?
LMNOP, Lasix, morphine, nitrates, oxygen, and positive pressure ventilation.
Good. And then also positioning the patient. So that is it for us today, and we look forward to seeing you next time.